Hello, welcome back to the Sim Lab. My name's Joe. Before we get started, is there any questions about the Sim Lab and the mannequin?
I don't remember how we activate the pulses on the mannequin.
So there's multiple pulse points on the mannequin. You got to push lightly in one of those 12 spots. If you push too much, it'll go off, but if you just release a little bit, you'll be able to feel the pulse. Most of the general areas, I think you already know which ones. Any other questions? Okay. Today, well, before you guys have been here, you've seen the videos, Team Steps videos. Today we're going to really identify call-out and checkbacks. Can anybody tell me about those?
So, calling out means that we're going to call out either what we're doing or what's been written on the board. And checking back is, again, if I've called out what's written on the board, then I can check back that I've done that.
This is like the first basic functions for teamwork, and I think early in our scenarios this would be good to help.
Yeah. Keeps us all up to date on what's going on in the room.
Eliminates errors, right?
Should.
Anybody have any other questions before we get started? Okay. Your patient. You're in the ER. You have a 56-year-old male brought in by a friend complaining of chest pain. Your vital signs: blood pressure is 159/78, heart rate is 100, a respiratory rate of 22, and then O2 sat is 97 on room air. Anybody have any questions?
Can I read those vitals back? It's blood pressure 179/78, heart rate of 100, respiratory rate of 22, and O2 sat at 97.
The blood pressure is 159.
159. That's what I have. Okay, thank you.
Okay. You guys have any questions? Okay, I'll see you when I get in.
Hello, sir.
Hi.
My name's Barb. I'm going to be the leader of your care team today. I'm going to introduce you to our team. Gavin, I have Gavin, Teresa, Barb, and Brenda. Okay, we're going to take really good care of you today, and I'm going to have Gavin start with asking some questions for you. Okay?
All right.
Hey, Mr. Connor. My name is Gavin. I'm sorry to see you here today. Would you like me to call you Andrew or Mr. Connor?
Andrew's fine.
All right, Andrew. So can you tell me what's going on in your own words why you're here?
I got this chest pain, it just won't go away.
That's no good. How long has that chest pain been going on?
It's about 45 minutes.
Does anything make the chest pain better or worse?
I don't know, it started when I was walking downstairs and...
Were you doing any activity before walking down the stairs when this started?
No, I just gotta get ready for the day.
What can you explain what the chest pain feels like? Is it sharp or dull or those type of?
It's just this crushing pain and I don't know. It goes into my left arm and jaws. I've never had this before.
You already said that it goes into your left arm and jaw. Does it go anywhere else?
No.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, and 1 being nothing. Or just very little, what would you rate your pain at?
This is a 10. I've never had stuff like this.
10 out of 10. Worst pain you've ever felt, huh?
Yeah.
All right, and you said it started 45 minutes ago?
Yep.
Okay, Joe, I'm going to talk to my leader here real quick, and we'll get started, okay?
Okay. Yeah.
My name's Barb. I'm going to check you over here a little bit.
Okay.
I see you're kind of sweaty.
Yeah.
Yeah, do you feel sweaty all over?
Yeah, all over.
Okay, I'm going to listen to your chest. And then I'm going to listen to your lungs. Okay, Joe, I'm going to have you sit up, but I want you to let us do part of the work there. Can I get some assistance to sit Joe up? Okay. Did that make anything worse, Joe?
No, it's just always there now.
Okay. Joe, we're just gonna get together, talk here, and decide what we need to do to make you better today.
Okay.
I think we're gonna leave somebody with him at this point,
I'll
because
stay.
he could be a possible cardiac. Brenda, would you mind just staying with the patient while we talk about the care plan a little bit? And then I'll update you, so. Okay, guys, let's do a huddle, and let's start with what our pertinent findings are. So Gavin, what'd you find in history? Or what'd you find on physical exam? Okay, guys, looking at our differentials, MI definitely is high on the radar. Do you not agree?
Yeah, absolutely.
PE still could possibly be shortness of breath. But Kevin, did he complain of any shortness of breath? Okay, so that's maybe not so. Anxiety, it could still be all three, but let's say we have to rule out the most deadly, so let's start with the MI. So let's do a 12-lead EKG right away. With some cardiac enzymes. Did he take an aspirin this morning at all?
I didn't ask that.
Okay, we need to know that.
Okay.
If not, let's give him 4 baby aspirins orally. And it's 10/10 for the pain, correct?
Yes.
Let's start with the nitro, 0.04 or 0.4 sublingual. And Teresa, if you'll look at 5 minutes and we'll reassess that to see if we'll give another nitro or not.
Okay.
We'll start here, we'll look at the 12-lead EKG, and we also want to get some cardiac enzymes, CBC, and BMP, please. Also, I noticed that his SAT is 92%, so Brenda, could you put him on some O2 at 2 liters per nasal cannula? And of course, we're going to need to start an IV before we get this nitroglycerin. Okay? Abnormal saline.
Okay.
Just at TKO at this rate.
All right, just to confirm, we're going to give aspirin 324 milligrams, PO, nitroglycerin 0.4 milligrams, sublingual once we've started the IV. Lab-wise, we're going to get cardiac enzymes, CBC, BMP. We're starting oxygen at 2 liters per nasal cannula, and the IV, once we get it started, we're going to start that at just normal saline at TKO.
I'm going to add a D-dimer to that, just so
Okay.
we can rule, see if the PE, with that, if there's positive or not. So we can rule that in or out, okay?
And then, Gavin, when we resume with the patient, we'll need a date of birth and allergies before we administer any medication
Absolutely.
as well.
Thank you. Thank you, sir.
All right, sir, you're gonna feel a slight pull because I took your IV. Do we have everything matched for medication?
Andrew, I have 4 baby aspirin I want you to chew up.
Okay.
As soon as I
There
get
you
that
go.
12-lead going.
Baby aspirin are given.
Got it? Thank you.
We definitely have ST elevation in the anterior leads, mostly. We may use some reciprocal changes on the other leads. So we really are looking at possibly a STEMI here, guys. Does everybody agree?
I do.
Yes.
So let's get the cardiac enzymes. Let's do those stat. We gave the aspirin, given the nitro.
Nitro's on board.
Let's also give, let's not give it yet, but let's get morphine, maybe about 2 milligrams at least, drawn up so we can get that on board also if we need it. And let's do a chest x-ray also. So I'm leaning more towards the MI. Does everybody agree?
Yes.
Well, our cardiac enzymes are way elevated, guys. D-dimer is within normal, so you can cross out probably PE at this point, Teresa.
Okay.
I think is a good candidate for cath lab. Does everybody agree with that? I'm going to, let's see, let's give them, what's the pressure?
163/80.
Okay, let's give that other nitro, and then in 5 minutes, let's give another one, and probably let's go ahead with that morphine 2 milligrams also. I'm going to call a cardiologist, guys.
Sublingual nitro's on board, second dose.